Pope Leo is urging participants in a Vatican-organized conference on the use of artificial intelligence in healthcare to ensure that technology supports rather than replaces interpersonal relationships in medicine. EWTN News Vatican correspondent Valentina Di Donato has more.
This week in Rome, an international congress came together to define the best ethical ways to use AI to give access to healthcare for all. It was organized by the Pontifical Academy for Life.
As a Vatican and a Pontifical Academy for Life, we started with the Rome Call for AI Ethics of 2020. And it was a document with the signature signed by also Microsoft, IBM, now Cisco, Salesforce. So there was a consensus that some basic values and principles must be present in artificial intelligence.
And the Vatican had the foresight to get involved early in the fast-moving tech space because, as Monsignor Renzo Pegoraro tells us, it's an important and urgent issue, especially in the application and ethics of medicine.
So with Pope Francis and now also with Pope Leo, the Pontifical Academy for Life, but other institutions in the Vatican started to analyze the challenges coming from artificial intelligence.
With 4.5 billion people lacking access to essential healthcare services, artificial intelligence has the potential to help bridge the gap, according to the World Economic Forum. John Lane is a radiologist and the vice president of the International Federation of Catholic Medical Associations, and he was encouraged by what he saw at this week's event.
There were certainly hopeful elements to the conversation, particularly regarding the theologians and the philosophers who spoke in regards to the implications of AI in healthcare. So provided that all the input into these systems will take that into account and allow not only theologians, philosophers, physicians to sit at the table to help design a system that is truly engineered for the common good, then I think there is hope.
The possibility of helping to make medical care more accessible in rural areas that are without adequate healthcare professionals is also a positive point that AI can help leverage. But there are also fears for leaving out the human touch that is such an essential part of the patient-doctor experience.
But a big, risk. My younger colleagues are afraid they'll be replaced by the machine. So, there are some risks involved.
In Rome, Valentina Di Donato for EWTN News Nightly.